I was in pain 24/7 and I couldn't sleep and I couldn't do anything. I had no quality of life. I was a virtual cripple and didn't want to admit to it. And I thought I could live through it and ignore the pain, but eventually it got to me real bad.
Years. This is the sad thing. Got to a point that even my techniques working out, they weren't too good because I was compensating for the pain. I would be walking, I'd have to wait for my wife would have to wait for me. So I'd have to call out for her to wait for me in the supermarket. I would do everything I normally did, but I was really in agonizing pain.
When was the last time you could do the simple things and not feel pain in your hip? Now, everyday activities are causing you to feel worn down, older than you are, unable to enjoy life without aches and shooting pains. And then there's the anxiety of how much worse it might become. Let's take the first step in getting back to health.
Welcome to A Better Hip. In this half hour, we are going to help you explore your options for becoming pain-free. Determining the cause of your pain can be difficult, so getting an orthopedic evaluation is absolutely essential. But before you visit your specialist, you'll most likely do some research to become better educated about your options. While most resources and websites will give you information about how to talk to your doctor, we actually ask the orthopedic surgeon about your options firsthand. Questions like, what causes the pain? How do you choose the right treatment? What type of recovery can you expect? How much of the pain will be eliminated? These and other questions will be answered. Ultimately, restoring the highest level of movement and function with the least amount of risk is everyone's goal. Now let's go meet our orthopedic surgeon. We traveled to Danbury, Connecticut to meet one of the few orthopedic surgeons who specializes in hip resurfacing in the state of Connecticut, Dr. Sanjay K. Gupta, a member of the Orthopaedic Specialists of Connecticut. His clinical interest is in treating hip and knee arthritis in all age groups, minimally invasive total joint replacement, and revision hip and knee replacement. Thank you so much for being with us today, Dr. Gupta.
Thank you for inviting me.
So many people are dealing with hip pain. Perhaps you can help us to understand what some of the causes are.
Let me just explain to you what a hip joint is. Hip joint is a very unique joint in the body. It's a ball and a socket joint. And just like any joint in the body, the surface of it is coated or has a cartilage which is about 2 to 3 millimeter thick. And that cartilage essentially has numerous functions. One of them, it's smooth. It helps for the ball and the socket to glide without any friction, and that causes no pain whatsoever. But over a period of time, there are certain diseases which affects this cartilage, and the common ones are, one is wear and tear as time goes by, called a degenerative joint disease, and then there are many other 20 or 30 different kind of arthritis which can affect a hip joint.
What's the most common type of arthritis?
Just focusing on the most common type of arthritis which we see in our daily practice is an osteoarthritis. And what happens is, over a period of time, the cartilage thins and finally wears away. And at the same time, you have small spur formation in the socket and on the head side of the hip joint, and also some cyst formation. And all this causes pitting and erosions in the ball and the socket. And eventually, over a period of time, the cartilage is gone, and essentially a person is walking bone on bone.
Bone on bone, is that what causes the most severe pain?
And that is when the pain is very severe, and because the cushioning effect of the cartilage is lost, essentially the motion is lost and the hip joint becomes very, very stiff. And the classical picture we see is pain with daily activities of life. Initially, it is just on walking long distances, and then the pain gets when you sleep, when you just are sitting down. The motion is very limited, activity is very limited, and depending upon what a person does, that affects his or daily activities of life.
I used to hang on to everything to move around until I finally gave up and went to crutches.
I just literally wore out my hip joint, and it got to a point where all the things that I do were causing me pain. I'm a very active person for my age. I mountain bike, I do martial arts, I'm forever in the woods climbing through mountains and everything, and this whole thing was coming to an end. I could still do it, but I was suffering. I was literally in pain. As a matter of fact, the students used to see me. I would my joint would actually click, and you could see my face grimacing as I did the techniques. And it was coming to a point in time where I couldn't do it anymore.
So does that mean the best option is medication and physical therapy?
Well, certainly initially, yes. That's the first stage. We try to help people just by what is called a non-operative method or a conservative methods. And there are several things to it. One is obviously have some pain medications, and there are various types of pain medications. One can take what is called a non-steroidal anti-inflammatories, and they can be bought over the counter, and there are certain prescription medicines for this. And if this doesn't work, because there comes a time when the arthritis is so bad and the quality of life is so bad that medicine can only do so much. They really don't cure the arthritis, they just take the pain away. And then person needs to stay active. And obviously any impact exercises like running and jogging where there's a lot of impact on the joint, that is going to hurt a lot. So what I usually advise people to do is to stay fit and keep their body muscles toned, is to do non-impact exercises like aqua walking and walking in the swimming pool, or water aerobics, or cycling or swimming. That's a very good way to keep fit, keep the muscle tone, keep the muscle going.
It sounds like medication and physical therapy are ways to manage the pain, but not really ways to be pain-free. Is there a way to get back to a pain-free lifestyle? You're
absolutely right, Stacy. Medicine and physical therapy can only do so much. They really cannot eliminate the pain 100%. If a patient wants to get rid of the pain, the only permanent way is to have a hip replacement. And there are various types of it. We have a traditional hip replacement and a modern method called a hip resurfacing. Just to go back to hip replacement in general, if you look at operations across all